I can, Dr. Morse. I'll start it now.
I've already started, Dr. Morse. Sorry.
Oh, okay. Thanks.
Thank you so much. So when we're done, if you could just send me a link, that would be awesome. Sorry about that, guys. All right. So let me make sure I can share my screen. Oh, goodness. All right. Let me get that going. So it gives me that option. So, all right. You guys should be able to see my screen, I hope. As usual, if you're not with the school or the health department, if you to drop off the call, we will post the slides and the recording now that we have that going on our website within the week or early next week. If there's any information we share today that needs to be shared with others in your department or school, please make sure to do that. Just a reminder, next week, the 17th, we will not be having a meeting, and I will not be available all of next week. So if you have any questions or concerns, just get those to your county point of contact or someone else in the health department. So first of all, I'm sure some of you have seen this. This study came out just recently, but it was a study of a very large number of people in California, looking at those who did or did not contract COVID, and wearing a cloth mask cut your risks of getting COVID in half. Wearing a surgical mask reduced it by 66%, and wearing an N95 or a KN95 type respirator mask reduced your risk of testing positive for COVID by 83%. So, you know, protection is greatest with those types of masks, but wearing a cloth mask still does cut your risks in half. So again, we don't want people to feel like they have to wear a respirator. Still, though, very good evidence continuing to show the benefit of wearing masks at reducing the wearer's risks of getting COVID. So for those who wear them, it reduces their risks. This is very busy, I know, but for those who do have mask mandates, I have gotten some questions about when to end those mandates. Here on the bottom left is a link to a recent blog from the Policy Lab. And they discuss that, you know, decisions regarding that obviously shouldn't be made based on whether or not masks are effective, because they are. And other factors really that are very local should go into those decisions, like your case rates, how likely are you to see severe illness from the virus, things like that, vaccination rates and things like that should go into your decision making. Obviously, masks will be more beneficial when you have high incidence rates rather than low incidence rates. On the right side is a table that the Policy Lab had put into their guidance in August for considerations for schools and parents when they're considering masking. So things that support masking are things like high incidence rates, if you're seeing a lot of cases in the schools, more cases in kids in the community, low vaccination rates. One of them was when vaccines were not yet available, or school-age kids are not yet eligible for vaccination. That's no longer the case for a K through 12 population. They all are eligible to be vaccinated unless they have some kind of contraindication. And then for families, you know, if they have household members who might be really at risk for severe illness, or kids who can't or aren't vaccinated who are at high risk. And then times where you might want to consider prioritizing masking or encouraging kids to wear masks are those higher risk times when they're congregated or in groups. So just some additional guidance there. Another study that I found that just recently came out, this is actually published research that has been done by the ABC Consortium or Collaborative out of Duke University. I've talked about them before, but this is just a publication of a large amount of the data they've been collecting over the last couple of years. So they looked at numerous schools from Wisconsin and North Carolina. So, over 100 schools, over 1 million students and staff in-person education, at the number of infections, the secondary infections in those schools. And they found that and at the second slide, I'll mention that there were mandatory masks in all of these schools and numerous other prevention measures. So it makes it difficult for us to really extrapolate some of our scenarios. But this was in schools with broad-reaching prevention measures. But they saw only one school transmission event for every community-acquired infection. So the risks in school are much lower than in the community. They did find that almost half of the cases that they found to be due to in-school transmission were linked to middle school or high school athletics. And 42% of the cases they felt were caught by middle school and high school staff were due to in-school athletics. They can't really say whether it was due to practice or games or transportation or social events associated with the athletics, but they did find that the risk of secondary transmission associated with sporting events was much higher than in other classroom settings and things like that. So they also found that distancing, whether it was on buses or in classrooms, did not seem to increase the risk of transmission in the schools. But again, in all of these schools, in all of these cases, they were in areas that had mask mandates and were using multi-layers of mitigation strategies. So we really can't sort out what masking alone or any of the other individual mitigation factors had to do with it, which is hard, I know, as we're trying to, peel away some of the layers, but it's still, another big, good study showing that when we are taking prevention measures, the risks of transmission in our schools are very, very low. So for your local data, you can go to the mystartmap.info site, the state data and modeling data. First slide here is actually from the CDC, just showing the United States as a whole continue to decline in cases, still higher than our last two surges overall, but definitely still declining. Michigan, we're also seeing a decline. Average percent positivity is 18.5. Our 3 regions here that contain our counties, positivity is still between 22 to 24%, so higher than the state average, but at least stable towards trending downward. The cases per million do continue to keep coming down, which is fantastic. And in our areas, they're between 700 to 800 or so per million, which is almost half of what they had been. So that is a good trend. And the daily hospitalization rate for COVID continues to trend downward. So the state hospitalizations for confirmed COVID is at about half of what it's been, getting close to that at least, still very high when we look at where it's been in the past, but it is coming down. And same with the ICU hospitalizations for confirmed COVID cases. The pediatric or childhood hospitalizations are continuing to come down as well. Again, still a lot higher than we'd like to see them, but still trending in the right direction. This is that modeling slide I showed a couple times before. Still just guessing, but scientific mathematic guessing. The guesses for weekly cases and weekly hospitalizations, kind of eerie how much they continue to follow on that yellow line, which is the optimistic line. So with all hope, we should be continuing to decline through February and into March. Unfortunately, the death count for weeks, the weekly death count, is more into the pessimistic range. So a little bit higher than we'd hoped for. So hopefully that will change a bit, whether, it's the time of year or just the age range of those who are getting ill, who knows. But unfortunately, that is a bit worse. Just threw in a couple of slides here that they had. U of M, Freudian slip. U of M has been doing a study for a couple of years now, following many individuals who have had COVID, just to see how they are doing. I'm sure many of you have heard of post-COVID syndrome or long COVID, but just finding that there, continues to be a large number of people that continue to have disability and symptoms after COVID. I did go into their full publication just to see, how far out are these individuals still having problems. And these are basically the people that they've been following all along. So some of these are at a year and a half, some are at about a half a year. But again, about a quarter of them have some degree of disability. 10 to 15% had some degree of disability to start with. This is another separate study looking at cardiovascular or heart and vascular problems after COVID. So after about a year, excess burden per 1,000 is what this shows. So after COVID, how many more people in 1,000 people have these problems that wouldn't have had them had they not had COVID? So, for example, about 12 extra people have heart failure, about 12 extra people have atrial fibrillation, and so on. So there are a lot of increases, heart attack, heart failure, blood clots, lots of different things that really affect people post-COVID. And so, again, these are just some interesting slides that they had in there that I wanted to share. So again, just a reminder that we won't have a meeting next week. I won't be available by text, phone, or email. So if you have any questions, I will get back to any emails when I get back. But if you need any help quickly, make sure to call another health department contact. So, all right. So if you have any questions, please put that in the chat. And then if you have anything you want to ask on the line, your line may be muted. I did mute the lines earlier on. You may have to push *6 on your phone if you are on the phone. Penny was asking if I could show the slide with the positivity again. I sure can. Let me get back to that, and then I'll share my screen again. All right. So these are the preparedness regions. They just kind of divide off our regions like this. So Montcalm County would be here in region 2. So that percent positivity is 24.3%. They started adding in this slide a few weeks ago. It's a struggle because, for example, in region 2, you have Kent County and Muskegon County. And so, those are pretty populated counties compared to the rest of the counties in that region. So it does get a little bit challenging. But again, if you go to the My Start map.info, you can see your county's positivity. But there has been some variability region to region. It has seemed, things have kind of worsened from the south up, specifically from the southeast up, and then things have seemed to improve from the southeast up. And that's kind of the same pattern we'll see with influenza. So you kind of see how, the numbers and positivities do seem to be better in the Metro Detroit area. So, hopefully that trend will continue. But when we see new variants and things, they tend to appear first in the southern part of the state and then crawl up north. So, so again, that just tends to be the pattern we see with things like this. All right. And then are the confirmed COVID rates coming down due to the number of at-home testing taken and reported positive? Yeah, so that's a big issue is, when we start to see numbers coming down, is it because we had a lower testing week because we had bad weather? Is it because we are seeing more home tests which aren't being reported? Many of you may not realize this, but antigen tests are actually counted as a probable case. That's just the way that they've always been labeled. The test itself is considered just a different quality of test, even though the CDC says it's a viral test and it counts as a case. When we go into the case description, it's classified as a probable case. So when you look at confirmed cases, that is not counting any of the antigen tests. That's a big part of what we use for testing now. So I have a really big issue with that from the get-go. So right there, we know that our confirmed cases are vastly undercounted. So again, that's where, reality, the numbers, the specific numbers alone really are not a great indicator of where we're at. The trends are useful, but we have to look at other things too. The percent positivity is useful. The hospital, the state of our hospital system is extremely useful. Are we seeing outbreaks places, things like that. So that's why we really have to look at a lot of different things. But absolutely, as people are using more antigen tests and then also more home tests, it is going to get more and more difficult to really know exactly what's happening. But again, like I said, the antigen tests count as probable cases. So when you look at the MyStart data, it does count in probable cases, and you can click a little button at the top to specifically include antigen tests. I don't really notice that it changes your data much, but it is a challenging thing. We found that staff is more likely to test positive closer to day 7 after exposure. We currently test on day 6. Would you recommend staying with day 6 or changing? So you can do whatever you're seeing. So when the CDC had changed those guidelines to 5 days, they had said right in there, a third of people will stay contagious after this. And they really didn't have much data to back it up. So if you are seeing that your area, however the virus is acting in your area, you are free to adapt to that. So if you're seeing that people are testing positive on day 7, it's completely appropriate, to test maybe on day 5 and 7 if you're doing like a test to stay type program, or if you want to test on, if you're doing a test for close contacts, my fear would be that if you wait till day 7, you might miss some of those that were positive on day 5 and they came back early. So just do what you feel most comfortable with. If you want to test them on day 5 and on day 7, if you have the supplies for that. But if pretty much all of them are testing positive on day 7 but negative on day 6, then that would be acceptable. If you recall previously, the recommendation was to test 5 to 7 days after exposure. And their thought was that, well, Omicron Omicron develops much quicker and, this, that, and the other. But again, if you're not seeing that, you are more than welcome to adapt. Sorry, that was really long-winded. How long might a person test positive after their initial positive? So with the antigen test, they should really go back to negative within a couple of weeks, but everybody's different. The PCR test can stay positive for weeks to months. So it just depends on the type of test. Is there an expiration date on the federal requirement for masking on bus? We have not heard anything suggesting that will be ending. I do know there's been chatter about the need to have kind of an expiration date on some of these mandates, but there's nothing definitive, and we've not heard anything definitive on that. So for now, all transportation still has that mandate. Any other questions? Again, put it in the chat or go ahead and unmute yourself. All right. Well, next Tuesday, the FDA Advisory Committee does meet to discuss the 6-month to 4-year-old vaccine. So that should be available soon. Not that it terribly affects the K through 12 school system, but just so you're aware. And those will be available through all of our health departments. If you know people or have kids of your own. So hopefully my family will stay COVID-free next week. And if you have any questions of who you need to contact next week while I'm off, let me know. But I have a feeling you all have alternate contacts available to you. But we'll get the slides and the recording out to you. And you guys have a great week. Jody, were you the one recording for me?
Dr. Morris, on my screen, it said Jessica Smith was recording.
Okay.
Yeah, I thought I was recording, Dr. Morris. This is Jody, but I'll see if it has the link and then I'll send it to you.
Okay, no worries. But whoever did, thank you very much. And once you have the recording, you can just send me the link and I'll get it off to our PIO and we'll take care of it. Thank you.